Hi, my name is Felix Rodriguez, and in this presentation, I'm gonna be talking about the labrum tear in the shoulder. The shoulder labrum tear is a ring of cartilage around the shoulder socket that helps stabilize the head of the humerus in the glenoid cavity. When this type of tear occurs is when the ring is frayed, disrupted, or torn. When a tear happens in the labrum of the shoulder for the patients, it can cause pain in the area injured, loss of movement, and stability in the area. Labrum tear can also happen to people of old age since their muscles, tendons, and cartilage are losing their properly strength and getting more fragile over the years. Over here is a picture of the labral tear. As you can see, the red part here is the labral tear, and this all of it is the glenoid cavity. The rehabilitation for labral tear, most of the times there is surgery required, that is arthroscopic surgery. The rehabilitation time for non-surgery is a total of 3 months or less, depending on the amount of pain the patient has. When it's a surgery required, is a total of 3 months. If it's a normal people, when it if it is an athlete, it's a total of 6 months of rehabilitation. For the rehabilitation time, the first month is to rest and only rise the shoulder frontally with help. The second and third month are exercises to gain mobility and flexibility with a therapist aside to help. The fourth month is to strain the muscles of the rotator cuff and stabilizers to move the shoulder freely without pain. The fifth month is going to be the same thing, strain the muscle stabilizers so it can move the shoulder without pain. And the 6 months will be like a test to test the mobility and the flexibility to see if you are clear to be able to back to the respective sport. Over here are some exercises that is done during the rehabilitation for the rotator cuff muscles so you can strengthen them more. I know that. Over here are some other pictures too when you're laying down prone and doing the T's, the Y's, and the row. The type of movement in the shoulder for the labral tear in a baseball player will be rotating the rotator cuff muscles. That will be an external rotation. The muscle related to that are infraspinatus, supraspinatus, teres minor, and subscapularis. The joints attached are the sternoclavicular joint, acromioclavicular joint, scapulothoracic joint, and the glenohumeral joint. The faces. Here are some of the faces for throwing a baseball. The beginner's phase, the elbows is flexed. The prep phase, the athlete is moving the shoulder backwards. The acceleration phase, the athlete is raising the shoulder from the back to the front up over the head. The deceleration phase, the athlete lets go the baseball with the amount of force generated to throw it. The follow through phase, the athlete let go the arm downward in his frontal side towards his opposite side, and the end phase, the athlete goes to his normal stance. Over here, as you can see, is an image of the faces to throw a baseball, and here are the references. And thank you very much for that.